What I'm going to do with this presentation is give you an overview of the research that we've been doing as part of the Beckley Imperial Research Program over the last 7 years or so. And really that's what I want to do, rather than get into the finer details of how these drugs work in the brain. I want to give you a sort of broader sense. So this might dissatisfy some of the scientists in the audience, but hopefully it will be more appealing on a broader level for the audience. So let's start with the molecular level. Roland touched on this, and really it's quite remarkable that we can hear about all these incredibly profound psychological effects of these compounds, and yet we know that there's a specific receptor in the brain, the serotonin 2A receptor, that seems to be crucial, seems to be vital for the action of these drugs and their subsequent psychological effects. So in the mid-1980s, it was found that there's a really incredibly strong correlation between the affinity or the stickiness of a psychedelic compound for a particular serotonin receptor, the serotonin 2A receptor. There are some 14 of these different serotonin receptors, but this particular one seems to be crucial to the action of these compounds, so that the higher the affinity, the more potent is the psychedelic. So for example, LSD has a very high affinity, it's very sticky for this serotonin 2A receptor, it stimulates it, and it's remarkably potent. We also know, based on the work of Franz Vollenweider and his team, that if you block the serotonin 2A receptor with what we call an antagonist, essentially a compound that gets in the way of anything else acting on the receptor, blocks the receptor, then you'll significantly attenuate the key characteristic psychedelic effects of a psychedelic compound. So what about the behavioral level? It's difficult to show a pretty graphic of representing this, so instead I'll just go through some of the findings from our team, but also more broadly in terms of the research that's been going on over the last few decades. So work's found that the serotonin 2A receptor and stimulating that receptor can positively modulate cognitive flexibility. So this is mostly animal work, really. And also low-level learning seems to be positively modulated by stimulating the serotonin 2A receptor. Also markers of plasticity or mechanisms of change in the brain positively modulated, especially in the cortex with serotonin 2A receptor agonism. A little work on creative thinking, showing, again, a positive impact of psychedelics on creative thinking, more so in the period after a psychedelic, but nevertheless, this action of sort of loosening the mind could still be useful within the acute state itself, at least theoretically at this stage. Also, imaginative suggestibility is something that we've seen positively modulated by LSD. Emotional lability, Mendel Kaelin will talk after me about the interaction between psychedelics and music, so this is relevant in that respect, that ability to both feel extremes of emotion, so extreme euphoria, but also the potential for anxiety and dysphoric feelings as well. Some nice work by Franz's team and others as well, showing that positive mood is positively modulated also by serotonin 2A receptor stimulation. So blocking the serotonin 2A receptor with an antagonist, and you don't get the positive mood effects of these compounds, psilocybin, and also the more general serotonin agonist, MDMA. We've also shown positive modulation of optimism. It's interesting to hear that Roland's found similarly, in his case with psilocybin, in ours with LSD. But we also looked at a behavioral measure of really pessimism rather than optimism in our depressed patients. And Taylor Lyons has done some nice analyses of this data, showing that the pessimism bias, so this misnomer really, that in depression you see a depressive realism, a more accurate appraisal of the world. I would say in clinical depression, and particularly the kind of severe depression that we're seeing in our trial, there's a sort of delusion. They're not seeing the world as it really is. There's this really quite evident pessimism bias that we're seeing is normalized post-treatment with psilocybin. So what about the brain network effects of psychedelics? Well, again, like I said at the beginning, I just want to give you a flavor of this, really, an overview. And sometimes an image can say 1,000 words, and really this has been one of our most popular images because it kind of does that. So we found that, for example, looking at communication patterns in the brain, you see a much more open, sort of fluid, flexible style of communication going on in the brain under psilocybin, under also LSD, than you do during normal conditions. Another key principle is that if you look at the integrity of normally well-formed brain networks, intrinsic brain networks that are highly specialized for different functions like vision, but also high-level things like introspection, sort of deep-level thinking, and one network that's implicated in that sense is a network that we call the default mode network. Seems to be especially engaged during states of introspection, sort of withdrawing from the world and daydreaming in your own headspace. So we see a decrease in integrity of a range of different brain networks, but we do see it quite reliably in this default mode network, and other researchers have shown that too. Draulio with ayahuasca, which he'll tell you about later on, and we've shown it with LSD and also psilocybin. So another key principle, we have this flexibility, we have the disintegration, but another key principle really related to that flexibility idea is that these specialized systems in the brain, these specialized networks that subserve different functions, vision, hearing, movement, and such like, ordinarily they have a degree of segregation, and as I'll talk in a moment, that level of segregation increases as we develop, as we mature. These networks parcellate off and then do their specialized functions with a high level of precision. Now what you see in the acute psychedelic state is that segregation is compromised, and the term I like to use to describe this is an effect of desegregation. So we're seeing a much more crosstalk between systems in the brain, and they're kind of blending into one, sort of melding into each other, such that if you look at the brain at a global level, you're actually seeing an increase in integrity at that global level. So disintegration in terms of specialized systems, but at the level of the whole of the brain, we're seeing a more integrated brain. Now, these are just terms really for the mechanics, but one way to help and assist us in communicating what's going on in the brain to a more general audience is to look at comparator states. Now, I think it's quite compelling when you look at how the brain develops normally through development from infancy, from birth into adolescence and eventually adulthood. Then you see changes in the brain that are quite characteristic and also quite reliable. And these changes are in the direction of an increase in integrity of these intrinsic brain networks, and also an increase in their segregation, how they split off from each other and become more specialized. Now, hopefully you picked up on this principle that what we're seeing in the acute psychedelic state is actually the inverse of this. And I think that's suggestive of a kind of regressive state in terms of where the brain is within the psychedelic state. There's greater fluidity, greater flexibility, and this is quite sort of reflective of what you would see when you look at the brain of an infant, for example. And you think of how our minds change and our cognitive abilities change as we develop, becoming more analytical, more sophisticated, more refined. And then we think of the psychedelic state and perhaps similarities with the infant state, kind of thing that William Wordsworth has written about so poetically. Heaven lies about us in our infancy, and this prison house of the ego developing as we mature. But if we think about that infant state and also the psychedelic state, it being more playful, more flexible, and more creative. So there may be a compromise in some functions, but perhaps there may also be a facilitation in other styles of thinking and behavior. So moving forward, what about making mappings between what's going on in the brain and our volunteers' subjective ratings in terms of identifying candidate neural correlates of the psychedelic state? Then really this is the name of the game. This is what we're trying to do. Here you can see Trump kind of disintegrating there. That was a sort of metaphor for ego disintegration. So I said I'd give you an overview. I had to include some details, otherwise I'd be accused of being a sloppy scientist. So I won't do that. We've looked at the relationship between ego dissolution and psychedelic dose, running a questionnaire survey. This is the work of Matthew Knorr, who will talk at this conference as well. Some nice work that's just about to be published. Now, a couple of our analyses, also one by Alexander Lebedev, who's at the Karolinska, has identified ego dissolution as being a core facet of the psychedelic state. And as I said, there's also this dose dependency with the psychedelic dose. Similar in many respects to what Roland's team has found with the mystical experience, the dose dependency in that respect. Now, that might suggest to you that ego dissolution and the mystical experience are related. That would be no great surprise. The likes of William James talked about that in his famous book, The Varieties of Religious Experiences. And if you look at, for example, other work, the work of Walter Stace, for example, he'll talk about this sense of oneness, this unitive experience, as being, in his eyes, really the core aspect of the mystical experience. Sort of thinking around this, we recently, or at least I came to the sort of view that these experiences are synonymous. They're really one and the same thing, that you can only really have a unitive experience if you have a dissolution of the self or the ego. And in developing recently an improved scale of ego dissolution, we have found a very strong relationship between ratings on this ego dissolution scale and ratings of the unitive experience as a core facet of the mystical experience. So that's all good and well, but as I said, the crucial thing is that we get some handle on what's going on in the brain during these profound states. And so the way we've typically approached that is to look at the relationship between ego dissolution and changes in the brain. We've seen quite reliably a relationship between the magnitude of the disintegration of the default mode network that I was referring to earlier, arguably the best candidate we have for the neural substrates of the self or the ego or our identity, personality. So the greater the disintegration of the default mode network, the greater are our volunteers' ratings of ego dissolution. This seems to be quite a selective relationship. In our LSD study, we found that this was only the case when looking at the default mode network, this relationship between its disintegration and ratings of ego dissolution. We sort of finessed that relationship as well by looking at a particular circuit, running an analysis looking at how the parahippocampus, a sort of subcortical facet of the default mode network, how that talks to the rest of the brain in the LSD state, and we saw that a disconnection between the parahippocampus and a cortical region that it's normally tightly connected with, correlated very highly with the experience of ego disintegration. So it's not just the default mode network, it seems to be this particular circuit within that system that is crucial to both ego dissolution in the psychedelic state, but more importantly, really, the preservation of the self or the ego during sober, normal, waking consciousness. Also, analyses that we've done with psilocybin, but more recently with LSD, finding a relationship between this global integrity, so the brain functioning more as a whole, and ratings of ego dissolution. And it's interesting just to put forward the idea that if ego dissolution and the sense of oneness are synonymous, and ego dissolution is correlating with the brain behaving more as an integrated whole, then perhaps there's a relationship there. Perhaps there's a mapping between, a more unified state of consciousness, perhaps, and a more unified brain. Just briefly, another aspect of the changes in brain activity that correlate with ego dissolution, we found that a particular rhythm in the brain that's very prominent ordinarily. You can see, oh no, my pointer's not very good. You can see that blue peak there. That's a dominant frequency in the brain that gets stronger, gets more pronounced as we develop into adulthood, and it's also more pronounced in humans than in other species, suggestive that this may be related to the high-level cognitive abilities and consciousness that humans have. Now, it's interesting, again, in that respect, that under psychedelics, under both LSD and psilocybin, we essentially see a kind of collapse, or at least very much a lowering of that particular rhythm. And that's especially prominent in a key region of the default mode network, the posterior cingulate cortex. So I got sucked into details a little bit, but an overview principle might be one of entropy. So entropy is a way of measuring the predictability of a phenomenon. And so we've done analyses looking at increases in brain entropy with psychedelics, but also there's a nice mapping between this quantitative measure, this mechanistic measure, and subjective experience, because another description for entropy would be uncertainty. So we're getting a more unpredictable brain, at least in the cortex, and people experience a state of compromised assuredness of the way that the world is, at least in the acute state. So some key principles there: flexibility, disintegration, desegregation, the desynchronization, the loss of alpha power, and this overriding principle of the entropic brain characterizing the psychedelic state. So just to finish now, to talk about our recent work in depression and to postulate some biological mechanisms that may be underpinning the improvements that we see. Well, first of all, in terms of sort of psychological mechanisms, as Roland's nicely shown, this relationship between ratings of the mystical experience and subsequent improvements in well-being. Now, we're picking up some preliminary support for that when looking at ego dissolution, that the more people will rate ego dissolution within the acute state, the greater will be their improvement in terms of their depressive symptoms afterwards. So just to offer you some quite nice, I hope, digestible analogies or metaphors for what's going on. We could think of the mind or the brain being reset in the same way you could think of a computer that's malfunctioning and throwing up an error message, and you're scratching your head and wondering, what can I do to sort this issue? And then you just push the reset button and it comes back working nice and smoothly and operating as it should. So that's one analogy. Another one is this experience of an overview, like how an astronaut would go up into space, see the whole of the world, and then wonder why they were arguing with their wife and getting so depressed about work and all this and that, all these details of everyday life. I think why this analogy is particularly nice is that when you listen to astronauts, there's a nice documentary on this, talking about this experience, they often say that they're left with a memory. They can't forget that experience, that wonder, that awe that they experience. So I think, again, in terms of the psychological mechanisms, this can explain what happens when, if you want, the prison house of the ego dissolves away, and then you have that broader sense of connectedness with other people and with the cosmos, if you want, as a whole. Also, this idea of a calm after a storm. And really, when we look at the fMRI results from our depression work, this analogy actually seems to work quite well, at least at this stage on a theoretical level. But just to sort of breeze over the design of our depression trial, open label feasibility study, now completed in 20 patients, although we're still collecting the follow-up data. Treatment-resistant major depression, so all the patients had failed at least 2 different medications. Virtually all of them had also tried psychotherapy that hadn't worked for them. We give 2 doses of psilocybin, a low dose, 10 milligrams, but still a psychoactive dose, and then a larger dose, a high dose, 25 milligrams. And these sessions are separated by a week. And we follow the Hopkins model with sufficient preparatory period, building a rapport between the therapy team to psychiatrists or mental health professionals and the patient before having the experience, and then also integration work afterwards. But this pre and post fMRI is what I'd like to tell you about, because it's fresh, it's novel. You likely won't have heard about these findings. So just to look at the different stages, if you think of the struggle in depression, you could think of default mode network connectivity in that state. You could think of the default mode network as kind of clamming up, sort of tightening up. There's some data looking at this effect, a number of different studies looking at increased functional connectivity within the default mode network, characteristic of depression, and correlating with certain symptoms like rumination, chewing over your problems, mulling them over. Then you think of the acute state, and most of the brain imaging data I presented here in these kind of principles relate to this acute state. I'm characterizing it here as a storm because it can be a storm in some contexts, but it's also useful because it allows me to speak about what's sometimes referred to as the psychedelic afterglow, which is the period soon after the acute experience itself. We actually did our imaging the next day. It would be great to do the next day and then the following week and following month and such like, but of course you're constrained by funding and what you can do. So we just focused on that afterglow period the next day. What we found is, here's the brain normally, I say normally, actually abnormally, because this is a patient group. These are the depressed patients at baseline, looking at medial prefrontal functional connectivity, essentially looking at the default mode network. You can see it there. Now, this is from a separate study. We didn't image our patients during the acute state because ethically that would be questionable, and the focus, of course, with this study was on trying to help the patients and hopefully get them better. But this is from other research where we've shown, as I've talked about earlier, this disintegration effect that you see within the acute state. But the new and intriguing thing for us is when we look at the brain the next day. And what we saw was a very clear and crisp sort of reformation, if you want, of the structure of the default mode network. But what was curious was that we saw these regions proximal to the default mode network that were becoming recruited into it. So it wasn't so much that the default mode network was sort of tightening as it would in depression. It was more that it was sort of expanding. Its spatial extent was broadening. And this is curious, and it was actually contrary to what I predicted, and I think probably the rest of the team. We thought that there might be a residue of the acute state, this disintegration that you see acutely. But if you think about this carefully, this makes sense, because after the acute effects of a psychedelic have worn off, they've worn off. You're no longer in the psychedelic state. So there's actually something both reassuring about this and also something which should drive us to advance and update our explanation of things. Just one sort of idea that might explain this is that post-treatment, this sense of a calm that patients report after their experience may fit with this notion of having a sort of broader headspace, being less tied up and wrapped up in the minutiae, the details of things, and mulling over why we're so terrible, for example, and why everything's so pointless, and instead just having a sort of broader kind of perspective on things, this calm. And what would support that, actually, is that when we did a binary split, looking at those patients who responded versus those who didn't, it was actually the responders that saw this expansion of the default mode network post-treatment. It's images from Leo Roseman, who's going to talk to you as well during this conference. Now, just to finish these are almost our latest data. Actually, there are 2 more data points at 3-month 3 months that I'd like to add in. One patient who's actually doing very well. Another, actually, I don't know how he's doing. I haven't opened the file. I only received it this morning. But these are the latest data. You can see 18 of 20 of the patients meeting standard criteria for severe depression, severe or very severe depression. At baseline, that was reduced to 4 of 20 at 5 weeks. Patients depression-free, almost half 3 weeks post-treatment. That's remission. So quite striking findings. 5 of 12 at 6 months. We don't have all the 6-month data yet. We only have it from 12 patients. But looking at the before and after changes, these are quite striking. And if you look at the effect size, so an indication of the magnitude of the effect, and you compare this with other treatments before and after treatment, this is actually, really indicating a, much greater efficacy. Granted, this is an open label trial, and so we shouldn't extrapolate too much. We've shown it's feasible. But in terms of the effect sizes, they are quite large, suggesting that something more than a basic placebo effect is going on here, because the effect size is much higher. It's in the region of 3. It's sort of 2-3 weeks post-treatment, whereas the effect size with placebo is typically around an effect size of 1. So much larger effect size than you typically associate with placebo. Now, just to finish, if I have time, just to read briefly. Oh, I don't have time. Oh, well, can I do this one? Just this. Oh, well, I will anyway. So this is from one of our patients, and of course, he's describing pre-treatment, how he's suffering a lot. He describes during the experience how it's kind of chaotic, but also he's experiencing fresh insight, an ability to sort of step back and see a broader picture. And this is him talking about how things are a couple of weeks post-treatment. He says, although it's early days yet, the results are amazing. I feel more confident and calm than I have in such a long time. My outlook has changed significantly too. I'm more aware that it's pointless to get wrapped up in endless negativity. I also feel I've seen a much clearer picture. Now I can enjoy things the way I used to, without the cynicism, without the oppression. At its most basic, I feel like I used to before the depression. So I'd just like to thank David Nutt and Amanda Fielding, also the MRC for supporting the depression trial, and the broader team, without whom this really wouldn't have happened, and I owe them a great deal, and many of them you'll hear from at this conference today. Thank you for your attention.